Hello everybody, and thank you for taking this class with me. You may not be able to meet my partner in this class, Mark Colson, this summer, which is really too bad. I'm sure you'd really enjoy him. He's totally a human tidal wave when it comes to energy. However, he's contributed so much over the past 11 or 12 years since he's been involved in this class that I wanted you to know about him, and I plan to acknowledge when we come across ideas that are especially from Mark. One thing that you ought to know about this class is, rather than really getting into things like particular injuries or surgical procedures, we're really talking about return to high levels of activity. So, for example, instead of thinking about what happens with a slap lesion repair of the shoulder, we are interested in, once you have done the things that you usually already know how to do as a physical therapist, restore normal range of motion and strength per manual muscle test, we're able to bring that athlete to the full level of returning to overhead sports like high velocity throwing. Or instead of learning about what happens with an injury like lateral ankle sprain, we're able to bring an athlete back to the type of activities that require high velocity loading of the lower extremity. The grade for this class will be generated through the following things, and I think it's a little easier than it usually is because life is tough enough already, especially in this period that we find ourselves in now. So there'll be a couple of written examinations which are done on your own, internet-based, and some evaluation of weekly work. Those include group discussions done in teams of 4. Those points for group discussions will be assigned, and then you will present your ideas regarding the answers to those questions in the following week's synchronous meeting. There's also some kinesthetic learning activities that are assigned, and there's some output, either a very short video of you doing that activity or some output, some scores or something. For both of those type of activities, if you do a sound job and you pretty much complete the requirements of the assignment, then you'll get the points. So scoring will be easier than it usually is in the past. We will also be doing a video analysis assignment, which we'll talk about a little later in the semester. And if you like, there's an extra credit video analysis. Last year, for example, 15 students took this class. There were 4 or 5 who had a B rather than an A close to the end of the semester, and all of them were able to bring their scores up to an A by doing the extra credit video analysis assignment. If the public health situation continues to improve, and we all really hope that it does, we will be able to have a lab session at the end of the class. Now, students are expected to participate in lab sessions as able, but if you have some sort of injury that might endanger you for participating, then for goodness sake, please just watch. I've led this class, I think, 12 or 13 times, and outside of muscle soreness, I've never had any injury. I want to keep it that way. You'll need shorts or leggings for most of the activities, and athletic shoes for some. Since we're going to be doing all of the lab activities in a single day, just bring your athletic shoes and bring your shorts. There are some reading assignments, which are PDF files of articles that are posted on Blackboard, and those are meant to prepare you with the principles, which we'll be demonstrating in the lab. However, please don't wait till the very end of the semester to do those reading assignments. They're distributed throughout the semester, and it'll be both way easier and way better for retention as you do them, if you do them over the course of this. The main difference between the static equilibrium equations that we thought about in biomechanics and kinesiology and the way that we're thinking about joint forces and torques in sports is that they are no longer static or close to it, but taking place at a high velocity. Therefore, there's a couple more interesting things to think about. I want you just to think about these things conceptually, because we're not going to actually do any math. Thank goodness, the math is way more complex than it would have been for a static equilibrium equation. So regarding the external moments, remember that the external moment is the product of the force times the moment arm. There you see the axis of rotation of the knee in running. There's the ground reaction force. There's the external moment arm, and let's say that it is 0.2 meters long. But as we are going to show you in a couple of ways over the next couple slides, the force actually changes because we are going fast enough relative to gravity that we're either subtracting or adding to the acceleration of gravity. We'll actually show this to you. Now, in the generation of the forces internally, in addition to muscle tension, we also have the elastic recoil of connective tissues at high velocities. This becomes a very important source of force. We're going to think about this really carefully over the next couple of lectures. So again, here is the knee joint axis, here's the quadriceps force, here is the internal moment arm, which is perhaps 5 centimeters, but because of the high velocity, we're also generating a lot of force from the elastic recoil of the patellar and the quadriceps tendon. Those of you who took calculus with physics will perhaps recognize this. The diagram on the left is the velocity curve. Velocity is the first derivative of displacement, and the diagram on the right is the acceleration curve. Acceleration is the second derivative of displacement, or the first derivative of velocity. Now, we're going to think about this a little bit, but we're not actually going to have to do any calculus. I just wanted to show you how much harder this is than a static equilibrium equation such as we had thought about before. So the actual weight, remember, weight is mass times the acceleration of gravity. So on the equation, I've defined it as the dynamic mass, or m dynamic, as you see. The actual weight actually changes according to your relationship, your movement, your acceleration relative to gravity. So over on the right side, here the acceleration is at its peak, and that's positive acceleration, as you see, it's denoted by the positive sign. And as we go through a movement, we go as fast as we're going to, and then we begin to slow down. And that is actually negative acceleration. The slowing down is negative acceleration. You go through actually a peak of velocity is right here where it intersects. Now, in order to actually know the dynamic mass, what a derivative is what that relationship is at any particular period of time. So the t in that equation is for time. So for example, if somebody is making a jump or landing a jump, you have to, in order to be able to figure out the actual force, you have to be able to calculate the acceleration at a particular period of time, which is shown as a tangent here. I'm actually going to show you this phenomenon on the very next slide. What you're going to see with this slide is how your weight, which is your body mass times the acceleration of gravity, actually decreases as your center of mass is going downward, because it's actually subtracting from the acceleration of gravity. This is indetectable at really slow speeds, but at rather quick speeds you can see it. So the person that you actually see from the back in this video that I'm going to show you in just a little bit is Carla Williams. Carla is a physical therapist, an alum of our program, who was a dancer before she went into physical therapy school. She's based at Cox South right now, and she's about the coolest person that I know. And if you see her, you may tell her that. But I'm going to show you what she's actually doing in this video now. This is a little bit, it's called saute in dance, so it's a little bit of a plie downward and then several jumps, you'll see. Very good, thank you. So what you see on the bottom here is the actual force between her feet and the insoles of her ballet slippers. There are these force transducers here. So the red is the left, the blue is the right. And you can see here is just the weight, but then it actually goes down as she plies for the first time. And so, although her body mass hasn't changed, her body weight has actually decreased because the downward motion, the downward acceleration of her center of mass actually subtracts from the acceleration of gravity. We're going to review some more biomechanical principles. As we have talked about in biomechanics, the limbs behave as springs, and we're going to talk about this in more detail in a couple of weeks. But just to get you started thinking about this, the limb all by itself behaves like a linear spring, which is what you see here. So if it's compressed, then it gets stiffer and it can recoil the energy. The joints behave like torsional springs. And what you see here is a diagram of a torsional spring. So as that bends, as it recoils, it releases energy, and the more it's bent, the stiffer it gets, so the more potential energy return there is. Limbs also behave as dampers, and dampers are energy absorbers. So damping can be from the surface, like soft sand, for instance, which is one of the things that I'm going to encourage you to do, if possible, in one of the kinesthetic activities. Here you see a gymnast who has just stuck a landing after a routine. And so the surface itself, the mat, is a damping surface. Also, she needs to damp with her lower extremities and her lower body. This is difficult. That's why it's so difficult to stick the landing. But that's absorbing the energy without doing anything with it afterwards, as opposed to a spring where you're absorbing the energy for the sake of recoil. Limbs without a surface to help damp the energy can also serve as dampers. Here you see a recent alum of our program who participated in a study with me that we published a couple of years ago, and she's going to demonstrate energy damping of the lower extremities. There you go. Show you one more time. This is called a drop landing, so that's an example of an energy damping movement. She's absorbing the energy with her lower body to do nothing with it afterwards. A third thing that limbs can behave as is as actuators. So actuators are just creating energy without any input of energy from the surface. So because they're creating energy, you have the highest metabolic demand. Here we have another recent alum of our program, and he is in the sand volleyball court just a block south of our physical therapy building. He's in the sand volleyball court because the soft sand is going to absorb the energy being created by the muscles of his legs and feet as he jumps onto this bench, as you see here. So that's actuation, no input of energy from anything. If I had not just described the answer to this question, this would be a really good first group discussion question. We've talked about interaction torques before in kinesiology and biomechanics, but they become really important in the context of sports because interaction torques is how we generate really high velocity things. Like for instance, you see here Venus Williams about to smash an overhand return. So in order to generate these interaction torques, first of all, her whole body is rotating forward, such as you see, and it's not going very, very fast, but it's her whole body. So there's a lot of torque because of the mass. Now added on top of that is the extension, internal rotation, and adduction of her shoulder. Added on top of that is extension of the elbow, and added on top of that is the flexion of the wrist. All these adding together can lead to a racket head velocity of 33 meters per second. This, by the way, is going to be the first of our we're going to talk about tendons especially in a unit that's coming up before too long. But we're going to review a little bit about it now. Now remember, and we talked about this last year in kinesiology and biomechanics, that ligaments and tendons especially are viscoelastic. That's especially important for tendons because the tendons need to behave like springs when loaded at high velocity. When they're loaded at that high velocity, then they can return energy, which is very good for sports, and it's very important to be able to move in high velocity. So much of sports is energy absorption and explosive energy return. However, the potential consequences of that is that since the muscle tension is highest during rapid eccentric muscle activation, we're also most likely to have injury to ligaments or tendons during that high-speed muscle activation. Now, the mechanical properties of muscles and tendons both depend upon a few factors, including the age of the individual, immobilization, really important, and loading. That is that the tendon can improve through the right amount of loading. Tendons and ligaments both can insert into the bone in two ways, either the direct insertion or the indirect insertion. In the direct insertion, there's transitional zones. The tendon or ligament transforming through the zone into fibrocartilage, and then calcified fibrocartilage, and finally the bone, as you see in the electron micrograph in the photo over here. In the indirect insertion, which is not as strong, the tendon or ligament inserts into the periosteum and also pierces the bone through collagenous fibers called Sharpie's fibers. Tendons and ligaments both are between 70 and 90% type 1 collagen when they're healthy. When they're not healthy, especially in tendons, we'll talk about this in another unit. Tendons are stiffer than ligaments because they have a higher percentage of collagen and therefore are more effective energy storers and returners. With this slide, we'll talk about the mechanical properties of ligaments and tendons. The ultimate stiffness is the newtons per millimeter elongation that a ligament is able to, or a tendon is able to sustain. So what we see on this diagram on the right is the vertical axis is the amount of energy being applied to the ligament. This is a stress strain curve of an ACL in vitro, and the horizontal axis is the amount of displacement. So what we see is the ultimate load to failure for this specimen is a little bit more than 1,000 newtons. The ultimate elongation before it breaks is about 7.5 millimeters, and the total energy absorbed is the total amount of area that's underneath the stress strain curve that's illustrated. Now, during cyclic loading, the tissue stiffness decreases. So that means both it is more easily elongated and more easily broken, which is why we see more injuries, ligamentous and tendinous injuries, at the end of a practice or competition than we do at the beginning. The consequences of long-term immobilization of a joint to the strength of connective tissue structures like ligaments or tendons is very severe. What you see on the left is a diagram. The blue line is showing the stress-strain curve of a healthy ligament. The red line, a stress-strain curve of a ligament that has been on a joint that has been immobilized for 6 weeks. So it should be a surprise to nobody, because you work with some patients that if a joint is immobilized for a while, the passive stiffness increases considerably. However, the load to failure, so the ultimate strength of a ligament, will decrease significantly, such that it will break at 31% of the initial strength to failure. This has to do with the remodeling of collagen that normal movement can facilitate, which we'll talk about a bit more as in later units. The good news is that tendons can adapt to exercise, so they get stronger and thicker. The bad news is that as the muscles get stronger, also through adaptation, the part of the tendon that does not adapt as quickly is the musculotendinous junction. And therefore, as we get stronger, the musculotendinous junction becomes more likely to fail with high tension muscular contractions. Here's a question that I'd like you to think about. What type of exercise do you imagine is the best at developing improved tendon stiffness and cross-sectional area? Maturity and aging has a significant effect upon the type of injury that an athlete could have. With very young athletes, you frequently see avulsion, that is, tearing of the bony prominence off of the bone, rather than rupture, because the tendons are stronger than the epiphyseal plates. So, for example, with very young athletes, you may see avulsion of the central promontory off of the tibia rather than seeing ACL rupture. After maturity, aging has consequences to different structures. So, for example, the consequence to the ACL is very significant. The ACL can lose 50% of its tensile strength by the age of 65. The consequences to the MCL are less severe, probably because the MCL has a much better intrinsic circulation than does the ACL. We will have a whole unit about the healing and repair of tendons and what can go wrong and what to do about it later this semester. So we'll think about that later. Life is hard enough already, after all, isn't it? Since injury to the ACL is such a common sports injury, we're going to take a few minutes to think about it in particular. In full extension, the knee is held stable by the ACL, the MCL, and the LCL. So the MCL and the ACL are frequently injured by the same mechanism, either hyperextension or bivalgus. And remember, until collagen matures, it is more plastically deformable because of its higher proportion of type 3 compared to type 1 collagen. Therefore, if ACL reconstruction is done, frequently surgeons will prescribe a varus valgus restraint orthosis in order to prevent valgus stresses from injuring both the MCL and the ACL, because if they were, it would increase the possibility of insufficiency of both of those ligaments. One more thing that I've recently learned is that the allograft is more likely to fail than an autograft. Remember, an allograft is taken from a cadaver donation, compared to an autograft, which is taken from the patient, him or herself. So for that reason, the clinical recommendation is that the autograft is done for young patients because then the graft is more likely to last for a while, but the allograft done for older patients because they're not going to put as much or as long term of loading on the graft, and it's more likely to last them as long as they need it to. Here is the final thing that I'd like you to think about, and I think you don't need me to really describe it. This is just one of the discussion questions that we're going to have, but this is really an interesting thing to think about and to speculate about the mechanism of what might have been the problem with this gent. How did his problem start, and why does he feel the symptoms that he does at this point?